Good evening, my beloved colleagues. First of all, thanking all of you to be in time. And myself as before, Dr. M. Usman Ghani here now talking to you. And today we decided a very important topic in our clinical exam. Whatever it is, PACES exam, OSCE exam, or any other exam, PLAB or somewhere else. It's a very, very important topic, a relatively new one. I hope you all are very much interested to learn about, and we are also interested to discuss the topic about today. With my gentle, humble introduction, we are proceeding. And this is our institute, you know, possibly all of you know almost. And this will be our topic today, the consulting over telephone. And all the time, those who attended my session before, you know that I prefer interaction, not to be a silent listener. So may I hope that some of you minimum to be talking to me, to interact with me, please. And just to make the session very live, someone to tell me that if I ask you, anyone never talk over telephone to any patient? I am asking a negative question. Never? Possibly no. Everybody, I think all of you today, everybody have experience to talk to your patient over telephone. Nowadays, the on screen, the video consultation also possible. But we will be highlighting today over telephone consultation, not the video consultation, because in the recent year, in the last diet, there was a station in the exam consulting over telephone. So I believe that today's participants, some of you appearing in future for the PACES or the OSCE exam or Ireland clinical exam, whatever you are, you all will be benefited. And what we will do today, I will try my best to give you some introduction of telephonic consultation, and it will be followed by practice. I hope some of you will be very interested to practice over telephone. I find Dr. Ibrahim here. You are unmuted. Do you like to say anything, Dr. Ibrahim? Or wrongly, maybe. Okay, okay.
I'm sorry, I forgot my answer. So sorry.
No problem, doctor. No problem. No problem. And try to manage your audio as well and the noise as well. We will be controlling here also if needed. No worry. Just try to be attentive to our talk. That's all. Just I start with a scenario. This scenario, interestingly, is relevant for a GP or senior house officer. Suppose you all of you understood when I use the word GP means this is compatible for the OSCE, for the MRCGP, family medicine. When I use the word SHO, senior house officer, I intended to mention you as a candidate for the PACES in general. Whatever it is, if I read, okay, I can read, but may I request someone to read the scenario, please? It's a very interesting new scenario. I will be always with you. Anyone, please, will feel interest to read it, please? Anyone? Yeah, Dr. Adad.
Can I?
Yeah, doctor, welcome.
So please answer the telephone when it rings. The
Yes.
examiner will be able to able to hear both you and the patient.
Okay, this is the instruction. This is the instruction to the candidate, and below is the patient's brief. Brief may be different. Please read on, please.
Mrs. Debashini Das is a 42-year-old female patient with Crohn's disease under the care of gastroenterologist for the last 4 years.
Yeah.
The last clinical GP letter 1 month ago states that Mr. Das was stable on azathioprine 125 milligram OD. However, she had 3 admissions in the last year with flare-ups of her colonic inflammatory Crohn's disease, and her colonoscopy revealed a well-defined lesion in the proximal ascending colon. We have discussed with Mrs. Das that surgery will probably be the next option, if things flare up again, although reassess should be done in time.
Thank you, Dr. Adan.
Please.
Thank you very much. So this, in general, a scenario of the patient given to you. Now, how the design could be for the telephonic consultation here. Suppose the patient will be talking to you that you are a senior house officer or working in some specific department, possibly maybe in the gastroenterology. Patient referred by GP to you, and patient request a telephone consultation with you. Maybe one that. Second thing, this thing actually stored and back to the GP of the patient. You know that if you refer the patient as a GP to the senior house officer, after evaluation, the senior house officer will refer back to you also. It may be the talk of the senior house officer to the GP, or it may be talk, that means the patient brief from the GP to senior house officer. We design the information as such. I think all of you understand now, those who are appearing for the PACES or ask whatever you are. From here, actually, we like to start now our journey, that to start with something negative about the telephonic consultation. If I don't know the information here, which will be the negative for telephonic consultation, so you will not be aware of that, and your consultation will not be a very perfect one. First of all, if we divide the problem of telephonic consultation, the telephone itself will have some technical issues, and the doctor will face some technical problem, and the patient also will have some practical problem. So these all one by one I like to highlight to you. The telephone ringtone is very insistent and tends to take precedence over whatever we are doing. I think all of you understand the message. In your house, anywhere you are working, suddenly a telephone is rang, and you definitely will be attentive to them, whatever you are busy with, anything important. So these are the problem, definitely. And the calls put through to doctors who are in the middle of consulting tend to interrupt the consultation. You are in the chamber, you are in the bedside work or somewhere, you are consulting a patient, someone called you over telephone. They want to talk to you, he or she want to talk to you. So definitely you are disturbed, and your patient on consultation patient will suffer also as well. The telephone alters the tonal qualities of the speech, and these can have an effect on the perceived meaning of utterance. If you can remember your life, anytime you consulted over telephone to your relative or any patient, possibly you could remember it now. There's a tonal qualities, means the sound becoming high up, low, volume is becoming high and low, and there is some interruption also. So whatever you are telling, what your patient telling might be coming to a different meaning to you. And the variations of the talking speed, whatever you are talking, you're talking maybe in the common normal speed, but the sound coming to you and sound coming from you to the patient, sometimes technically speed is varied. It may be high speed, it may be low speed. All of you have this experience. And regarding the mobile phone, the cell phone, the problem of the quality of connection, all of you understood. And if you compare the previous land phone of the previous era now with the mobile phone, all of you understood now. In addition, in the mobile phone, there is a stored voice message system. And even nowadays, in the land phone also, there is a system. If you think that the voice message or the stored memory of the voice message is useful, okay, it could be useful, and sometimes it could be harmful as well. Everywhere there is a chance of the breakage of confidentiality. You send some message to the mobile phone or the telephone, it will be stored in the memory, but the unauthorized, the not intended person over the memory and listen your voice. But you send some very, very private information to the patient. It may happen. Take care of this. Now, you see, you are very busy and receiving one phone from here, one phone from the land phone, with the files and patients dealing in online anywhere. So you will become like that. You will be puzzled by the telephone. Okay. And in the patient issues are not everyone likes talking on the phone, especially about the personal matters, doctor. And people who expect faster response with actually people on the telephone expect faster response. Whatever you are doing, they don't bother with the telephone calls. In this way, there's the chance of queue jumping. You have to break the queue of the patient in between someone entered in your talk. So there is very unusual and very embarrassing situation you may face. Rapidity of the access can become a problem because anytime you are available over telephone until you lock your phone. This is the one way. And the other patient issue is the patient prefers it for easy access, definitely for the low cost as well. Sometimes without your consultation fee, they can call you because you're very open in the social media somewhere. Doctor, what is your phone number you have given? Anyway, doctor. And the doctor issues is very important. The doctor can't use observatory eyes because patient not in front of you. I told that the chance of breakage of confidentiality is there. Control of consultation also may differ. You cannot control over consultation. Those who attended before some communication classes many times before with me at best, that how to control the consultation actually we discussed. Interruption to be very professional, not suddenly that, okay, stop, now I would like to tell something else, not like that. It needs some professional skill as well. But over the telephone, patient is not in front of you. By talking only, you cannot stop or you cannot control the consultation. That the lower point, the interruptions and the acknowledgement can be problematic. Sometimes you need to touch the body of the patient in a professional manner. Sometimes you need to use your the eyes to express something, some body gesture, give you some message to the patient. It is not possible by telephone. With the limited flow of two-way conversation, you have this experience, both parties talking together, and the word is over, what I say, overlying to others, each other, and resulting in a meaningless talk, and you cannot understand each other. So this is actually some hazards of the hazards means rather the disadvantage of telephone consultation. And now I like to show you that anytime you may be distracted, like maybe today, a significant number of participants today I find here around now, myself including 78, might be that all of you are not equally attentive, doctor, if you don't mind, I like to say. And if you become distracted from your consultation, whatever it is, the telephonic or maybe online, what may happen, doctor? You are consulting as online or on the telephone, you come and maybe you're talking to the patient, you have a chest infection and maybe a computer virus, maybe like the doctor. So it's very important whenever you talk, and we will be coming to your case practice now. And before going to the practice, I like to highlight some principles of telephonic consultation. I'm requesting again, all of you, my beloved colleagues, try to be attentive for each and every patient. And I know that this maybe today's discussion for most of you may be very new discussion to you in a very organized fashion. So let's move now. Just remember, when you talk over telephone, answer the telephone promptly. It is better. Otherwise, it will be ringing. So answer the telephone promptly as early as possible. Then state your name. Sorry, doctor, there might be a little the printing error. State your name. And before asking any person's name, you know, the courtesy, I have to tell my name, what I am. Then you ask who is talking to you. Or patient can talk to you, start the talk to you by introducing himself or herself, whatever it is, but it is the courtesy. Doctor is to state his or her name. Then you collect the caller's name and telephone number as well, if it is not visible in your the dial pad in your device. And try to talk directly to the patient. If possible, sometime the patient's attendant is talking to you. Attendant may not be feeling encouraged to talk to you, or somehow patient is away from the scenario, but try to encourage the patient to talk. not a third person. In unavoidable situation, definitely we will talk to the relative or other one. And record the date and time of the call. Date and the time. So in the exam hall also, when you will be talking, you will take a note on your paper, and the paper in front of you, and the PACES examinee or OSCE examinee, if you did not appear till now, I like to highlight that you will be given a paper inside your station. So you can write anything, whatever you want there with the pen and the paper. So you have to do it in front of the examiner that you are writing the time and the date of the call. And record the person's name, age, gender, and the obtain medical records if available. How will you get the medical records? Suppose in the era of the internet communication, you may get the informations by email or even your any other social media. You can get immediately, or if you make a second step consultation, first step, you advise the patient or the relative to send the medical records or informations to you, maybe by mail or in the pictures manner, no problem. All of you possibly in the last 2 years, more than two, busy with the COVID time, significant consultation happen in this way. And the next point is take a detailed and a structured history. Don't think that patient is not in front of me, so I think I have to select some topics. No, the consultation, the talking is possible. And the very, very old saying is that for the diagnostic purpose, around 85% cases can be diagnosed by talking only, though patient is not in front of you. So it is possible. Most of the data from the history you can collect by telephone talking. And provide, after consultation, that means you are reflecting to the patient, provide advice on treatment or the patient's disposition, advice about follow-up and safety netting. In the meantime, most of you know the word meaning safety netting. What you will address any worsening symptom or symptoms failing to improve apparently within a week, or any new symptom develop, what patient is to do. This is called the safety netting. And after talking, summarize the main points covered. I intentionally highlighted here because there might be already happened some interruption of your telephone communication. There may be intonation, something technical problems you faced. So there might be some confusing message given to you and came to you as well. So summarization is mandatory. You know that those who are appearing in future, how to summarize the patient brief to the patient again. Request the caller to repeat the advice given. I can remember, doctor, when we gave the training orientation for the PACES and the OSCE, most of the time we tell you that after telling something, we ask that, is it okay? Is it okay like that? So is patient in front of you? Is it okay? Is it okay? It's very justified to save your time. But for the telephone consultation, remember, it will be very mandatory. Patient will tell you back what patient understood. Now I can remember, doctor, that 3E model we discussed in our basic consultation talk before. 3E model, first is that explore. That means how much patient knows. Second E is you explain. And third E is explore again from the patient. So that is that's three things. These are the very basic principles to make a patient understand of anything. So 3E you must follow here, especially for telephone consultation. And if needed, it can be done several times. That means you talk 2-3 minutes, then you try to make a summary and tell the patient what he or she understood you. So you may do 2 or 3 times. This is very, very special, important issues in telephonic consultation. Okay. And finally, and you can remember some of you also, after finishing the consultation, we actually, I'm not telling the teaching, rather we're advising all of you that the last 2 question is very golden question to the surrogate or to the patient. Do you like to ask anything more? Do you like to add anything more? So this is the thing, any outstanding questions or concerns remaining there, you must ask it. Then finally, who will stop the talk? Who will close the call? Let the caller disconnect first, not you. I hope all of you will understand all the things. And this is the three possible the consultation principles of the skill you can show in your telephonic consultation. Only one thing, if you can is you can see the screen here. Only point number 3, utilize body language and eye contact. Putting the patient at ease. Actually, the seating arrangement other we mean of, but here putting the patient ease means by the telephone in the introduction, patient should not be embarrassed from the beginning. Otherwise, all of the thing you can do from these 23 basic rules of consulting skill. If anybody doesn't have, we can provide to you, doctor. Don't feel shy. Already we discussed it many times before. And remember that the telephonic consultation over there may be patient or any third party, or even it could be interpreter or translator also sometime. So you need to be aware. Nowadays, as the exam system started with telephonic consultation, more likely he or she will be a patient. This is my assumption, but in future, the trending may be changed. Anyway, and the patient can be, if the patient is there, maybe that a new patient will be talking to you, or you will be seeing your follow-up patient, or patient may be referred from somewhere, maybe GP referred the patient to you. So keeping all of this thing in mind, we will go to the practice session now. Before going to the practice session, if you have any things, doctor, to ask me, you can raise the hand. Please, anyone. And in the meantime, we will give opportunity to 2 doctors to practice with me today as much as possible, and get ready mentally, anyone. And but before appearing, if you have any query, you can raise the hand until I talked about any technical point. Please, anyone? Dr. Adan?
Yes, sir. It's clear.
Clear? Oh, good. So may I ask anyone from PACES examinee or intended to prepare as PACES candidate? Anyone, can you raise your hand to be talking over telephone? I will try my best to surrogate. Anyone, please? Dr. Adan, welcome. Very good. Thank you very much. So be unmuted, Dr. Adan. Yeah, Dr. Adan. Be unmuted, doctor. Your mic is closed.
Yeah, sorry.
Yeah, thank you. So I don't know, possibly in coming pages, the pages 2023, the communication station will be of 10 minutes time. And there will be no question answer session by the examiner like before. So in the 10-minute time, you will be given an alarm bell or alarm after 8 minutes. And the last 2 minutes, you need to conclude your consultation. I hope you understand it, Dr. Adam.
Yeah.
Okay. So you will be given 10-minute time. And then later on, I will invite any OSCE candidate after Dr. Adan performance. I hope anyone will be very ready and you will enjoy, and I will enjoy as well, no doubt. It's very, very new thing possibly happening to you. So this is the instruction as before, Dr. Adan. Again, you have gone through before, and you can read again 1 minute within, I think. You can just read by yourself. Silently, you can read. All of you. So I will be preparing my timer for you here. Usually PACES situation is like that, but not OSCE like that. I will show you the OSCE, how it may be given in future. So any OSCE candidate, please get ready for later on, the second case. So if Dr. Adan, you are ready, we can start.
Okay.
How to study, that I will tell. Enter, please. Then you will start. Start means you understood that there will be a telephone ring to you. I will tell that telephone is ringing. Then you will receive the phone. Okay?
Okay. All right.
So who will be talking? Actually, you don't know. Maybe, but possibly your patient will be talking to you. Okay? So you are a doctor in gastroenterology clinic. Have you seen doctor? You are a doctor in gastroenterology clinic. That means this information messages the transferred to you from the GP. Clear?
Okay.
Okay. Enter, please.
Okay.
Phone is ringing.
All right, so I picked up the phone. Hello, good evening. My name is Dr. Aden, and I'm one of the doctors here in the tummy clinic. May I confirm that you're Mrs. Debashni Das?
Good evening, doctor. Doctor, yeah, doctor, you are right. I'm Debashini Das, doctor. Actually, I need to talk something about my health, doctor. Would you mind if I talk, doctor, right now?
Yeah, sure. Just let me go into a quiet place so yeah, we can talk regarding your health condition and about your concerns as well. Okay. So
Yeah,
yeah, you can.
doctor. If may I tell my talk first, doctor, if you don't mind. Actually, my GP referred to you, doctor. My GP sent to you, and he told me that he already sent my messages to your inbox, doctor. Possibly, in the meantime. Am I right, doctor?
Yes, yes, Mrs. Das, you're right. So we received a letter from your GP, and we all has reviewed it, and we already know that you have been, just having a condition called Crohn's disease,
Yeah,
and
doctor. Yeah. Thank you, doctor. Thank you for your advance information, doctor. So actually, doctor, now I am having the trouble, doctor, on and off. I pass, lose stool, and the blood mixed with the stool, doctor. Actually, what I have to do now, doctor? Please help me, doctor.
yeah, sure, we'll definitely help you regarding that. So we have reviewed your tests, and the last camera test which was done. So are you aware of that, right? The camera test which was done recently. Are you aware of the results?
Yeah, doctor. Yes, actually, the
Mm-hmm.
I have seen by the clinic or whatever the ward or the department
Yeah.
before, doctor, and I
Mhm.
was advised to follow to take some medicine. I know, doctor, I know, but now that, doctor, my health is not behaving well, doctor. For that, what I have to do now, I want to know, doctor, from you.
Yeah, sure. We'll tell you about that. So, just to be on the same page, I would just like to clarify what the findings were. So, the camera test, which was done recently, actually showed, a well-defined, we can say a lesion or growth sometimes, like in the, your
Yeah,
yeah, in your part of your tummy.
yeah, doctor.
So, the multidisciplinary team and the tummy doctor and the specialist have decided that surgery will be probably the best option if the things if the things going like continue to flare up again and you does not respond to treatment. Did you get my point?
Yeah, doctor. Yeah,
All right, so yeah, considering that you have been already on these medication which we call as a thioprin, right?
yeah, doctor. Yeah.
And apart from that, you also had recurrent admissions in the last year with these flare-ups, and you had quite a bad, some soreness in your tummy, and so sometimes what happens when the first line treatment options does not work for our patients, okay, and they don't respond well and they have continued flare-ups. So we have to think about something else. And considering the fact that the camera test revealed lesion in your, inside of your tummy, the basically the bowels. So yeah, the surgery will be probably the next option. Uh,
Surgery, doctor? Do you think is very mandatory now, doctor? Right now?
so we will be keeping monitoring the things, okay, Ms. Das. We'll definitely keep you in a close follow-up, and we will see that how are you responding now to the treatment. But it will be probably the best plan if your things, continue to flare up and you don't respond to the medications.
Oh, okay, doctor. Actually, what operation to be done, doctor? How it will
So
be done, doctor?
Actually, first of all, we will be keeping you in a close follow-up, right? We will be monitoring you for the treatment we have given to you, and we will see that how you're responding, and you will be reassessed timely, okay, on the regular basis. And then, if the things are not better and things are not responding, so we will involve the tummy surgeon who will decide that what sort of surgery will be best for you to treat your flare-ups and to treat your condition. Hope you got my point. Are
I
you following
understand,
me?
doctor, but actually,
Yeah.
doctor, I'm afraid of surgery operation, doctor. I'm thinking that will there be any option other than operation? It would be better for me, doctor.
Your concern is quite genuine, Ms. Das. At this point, we have considered other options as we are already, giving you as a thioprin and so. But this time, actually, as the camera test reveals something, a lesion in your gut, so it would be reasonable to remove that abnormal thing so that,
Okay, doctor.
yeah.
Okay, I understood now, doctor. But doctor, if the lesions, the tissue is removed, doctor, will I be completely okay, doctor?
I highly appreciate your concerns, but I'm afraid, Ms. Das, it will not completely cure your condition. However,
Oh
it
my
will.
God, oh my God, doctor, what you're saying, doctor? Please, doctor,
I'm
if not completely okay, what will happen to me, doctor, again?
It's not completely curable, but treatable disease. Okay, the Crohn's disease, which we are talking about, we have very good treatment options. We can treat the patients according to that. But unfortunately, somehow this is disease actually occurs due to the problem of defense system attacking your bowel lining. Okay, we can just control it. But be sure that Ms. Das, we are here and we'll try our best to manage your symptoms
I
as much.
understand. I understand, doctor. So if the one-time operation is done, then thereafter I need to follow some instruction. I need to take some medicine. That's all, doctor.
Uh, no, Ms. Das. Actually, if your operation is done or maybe not, so still you will be in a regular follow-up. Still, you will be requiring the treatment and medications. And this condition sometimes requires, I'm afraid to say that sometimes multiple surgeries are required in the future.
Oh my
But
God,
hopefully,
I'm very unfortunate, doctor, having such a disease, doctor.
I'm really sorry for that you're thinking like that, but be sure that we will try to manage your symptoms in a best possible manner. I can try to understand it's quite a hard time for you at this moment to have a condition which is not completely curable, but uh, the, we have a lot of good treatment options for that. Okay, and we can provide you with them, and you can actually live a near good quality of life. Okay.
Okay, doctor, thank you for your nice messages, doctor. Actually, I need to think more, doctor. Really, I'm a little frustrated, doctor, now that mean operation may be needed, doctor. But thankful to you,
Yes.
doctor, to tell me the details. Uh, doctor, just what I have to do now, doctor, you just tell me, please.
Yeah, yeah. So at this point, we are not, sure. First of all, we already formed the multidisciplinary team, right? Including the tummy surgeon, and everything will be reviewed and reassessed, and you will be kept in a close follow-up to see that whether you require surgery or not. Okay. There might be a chance that you might not require if your flare-ups are controlled and
Okay,
you're
okay,
taking the
doctor,
medication.
okay. I hope so, doctor. 2 minutes left. 2 minutes left.
So, okay. So may I know, do you have any other concerns or confusion so far we have talked about?
Yeah, doctor, when I have to see you, doctor, for the operation, doctor, is very emergently needed, doctor, or can I have some days, doctor?
No, no, it's not emergent at all. We will be discussing it first of all with the surgeon that if he thinks that, your disease as it would be only option, if your disease and flare up does not respond to medications. So it is not urgent. We will give you information, a lot of, leaflets and brochures we can give you that you can actually read through that in detail and have a better understanding of what sort of surgery would be done.
Okay,
But
okay,
obviously you will be explained very well before the procedure, and you will be informed quite a time before, so that you will have a lot of time to think or so. But yeah, it does not
okay,
it does not require.
okay. Yeah, doctor, you told me that some growth and some tissues, possibly some bowel will be removed, doctor. Am I
There
right?
is a possibility. Yeah, there is a possibility, but obviously it will all be decided once, maybe the tummy surgeon will review you that how much, what sort of surgery you need. Okay, does increase amount of bowel should be removed, or there should be a small piece of bowel which can be removed and, closed again.
Okay. After the
Yeah,
removal
so
of the bowel, doctor, what will happen to my bowel activities? Rather, what I have to do, doctor, later on?
Exactly at this point, first of all, I'm not sure that what sort of surgery you will be requiring. It will be decided
Okay.
by the surgeon, right?
Okay.
But there is a chance that your bowels will be closed up again, and there is a chance sometimes that when the bowel is not healthy and fresh, we have
Okay.
to sometimes, put a bag to directly attach the bowel to the skin.
Okay,
And
doctor. I understood, doctor. I will see you immediately, Dr. Whenever you inform me, doctor. Thank you very much. Time up.
yes,
Time up.
okay, thank you for your time.
Thank you, Dr. Adhan. Dr. Adhan, what is your the experience right now? Did you talk like that before?
No, it was a bit
It's the first time.
I know basically in practical life I have talked to the patients and
Yes,
taken
yes,
their
practical life,
history,
but not for exam purpose.
no.
Is heartfelt congratulations to you really, and felicitation that you have volunteered for all of you today. Around 100 participants today. I think some of might be trying, cannot enter in the Zoom. Now, my other colleagues, beloved colleagues, who listen this, who observe this, any comments of the performance? And interestingly, there is no interruption of the internet and the communication, and telephonic technical problem over not there. It is sure. But
Yeah.
what is the problem for the patient, for the doctor, or any comments of the performance, or any expectation you had, but we could not do? Please, anyone, raise your hand. Please start. If anybody feel better to talk about. Somebody written in the chat box to explain the free model. Actually, I will give you the link for the detail, no problem. But about the performance today, anybody wants to comment here? Dr. Adhan, if you have any friend doctor, you can refer to him or her to comment of your performance. Anyone in today's session? If you feel better.
Yeah.
Silence is
I don't.
common, common attitude, but silence is not good for the learning.
Yeah.
Actually, I don't
Actually,
like to comment here more because I am also surrogating this thing in this manner for the first time, and I organized the talk. Actually, it is the extract of my family medicine experiences before. In the PACES, the things that happened very newly. So there is still there is something to be improved more. And today, so I had intention to give some technical, what I say, intervention here. Suddenly close the communication by the online. I could mute the doctor's talk, or I can make a disturbance in the patient's talk. And how will you settle it later on? So in future, we can do it by how I manage the technical problem of telephone or some other messages. I have a plan for the future, but for the first time, actually, I enjoyed also as well. Anyway, our colleagues are now thinking that for the first time, they have listened. One colleague, sorry, doctor, I cannot address your name. Can you introduce by yourself, doctor, by your name? Who will have comment now?
Yes,
Please.
I am Dr. Ahmed.
Welcome, Dr. Ahmed, please.
It was a good conversation, and according to this scenario, it was as it was written that if there was a flare up repeatedly, and it was they may have to go for surgery.
Yeah.
But I'm somewhat there was because the patient is on azathioprine.
Yeah.
And there is the information that you will have to go for surgery if the flare-ups are going on like that.
Yeah.
But regarding, I was confused about the scenario that why they whether we have to assume that this before surgical option. Is there any medical last resort we are going for monoclonal antibodies, whether we have to try or not, or whether regarding performance, it's very good and very nice to listen like that for the first time. And
just to know, doctor,
regarding the scenario,
yeah, Dr. Ahmed, performance of the doctor or the surrogate? What do you mean?
No, both are definitely surrogate. Surrogate is definitely more experienced. We hope.
Thank you, doctor. Thank
But
you.
both of the things are from both sides. It's good. But
Thank you.
and especially listening for the first time.
Maybe we are also thrilled really for your comment. Just to come to the topic again, actually for the telephonic consultation station, mainly of the performance. Just remember, it's a technical, rather to say a technical station. Not very scrutinize the informations of the patient and others. There will be very simple informations. More likely to be. I am gazing as my last many years experience. So suppose you said that monoclonal antibody, already Dr. Adan said that there will be a multidisciplinary team, including the gastroenterologist.
Yes.
And if you go through, all of you go through the information in the last sentence, the Mrs. Das, that surgery, we have discussed with Mrs. Das that surgery will probably be the next option. It is not the mandatory one. If things flare up again, although reassess should be done in the time. So reassessment done means surgery is not mandatory. So it is a knowledge-based information actually you're talking about.
Yes.
And very happy to hear you, Dr. Ahmed. Thank you very much for your comment.
Okay.
And anyone, please, who wants to talk? Someone unmuted. Feel free, doctor. No one. So I think
sorry, doctor.
Dr. Ibrahim here. Yeah, doctor, please.
Yes, I have question, please, doctor.
Please.
This telephone consultation, I think scenarios will be communication scenarios. I'm talking about basic scenarios.
More likely. But if related communication, the related messages or data you must take. If you want to give a management plan, you must have some information from the history, but not examination. More likely it is of communication station. Already I told you 10 minutes station newly introduced from PACES 2023. Yeah, doctor, thank you.
Yes,
you are right. If no more comment, last Dr. Adan, it's my again heartfelt thank to you. But I like to comment a little, Dr. Adan. I don't know that do you have this is the nature to talk over telephone a little rapidly, Dr. Adan. Today the sound is very good. Communication the technology is very useful today, and no disturbance. But is your habit to talk a little speedy like that, or you talk a little slowly, Dr. Adan?
Actually, I talk too much, and I don't know exactly, but maybe a bit in hurry.
I was expecting other colleague could comment. Talking just as a telephone, what we talk in a very lively manner, not an artificial way. That my little suggestion for you. Otherwise, in my sense, we have done very nice, doctor. Very fantastic. Thank you very much. Thank you very much.
Thank you, sir, for giving me.
So we may jump to the next case now. So who will be the GP now? Preferably for OSCE. And already in the OSCE, the MRCGP UK and other OSCE, the advanced country, they adopted it. But for the South Asian, it may be a new thing the South Asian or MRCGP International. Anyway, who are planning for the OSCE also, may I invite anyone, please? It will be like OSCE means, again, it will be of 10 minutes time, but the instruction is like that. No data about the patient, because the GP is to see the patient for the first time. So it might be your regular patient or patient himself or herself, or on behalf of a relative will be talking like that. Yeah, welcome, Dr. Aisha. Can you hear me, doctor?
Yes, I can.
Thank you very much. I hope your sound is okay and no noise beside you.
Yes.
Okay, so you will be given 10-minute time. I hope all of us again be with us, and if you need doctor after the consultation is over, then we will have comment and we will be benefited. All the participants will be benefited, doctor. And I find that very huge crowd today, around near about 100 participants here. So doctor, you just think yourself 1 minute that telephone will be ringing, then you will receive according to the instruction. Examiner will be able to hear both of you and the patient. So possibly in this instruction, there will be patient over there, but I am just, I will be maybe tricky that on that side may not be a patient. Okay, remember it. Okay, doctor?
Right.
But
Yes.
just for preparation, I'm talking to, otherwise no problem, doctor. Okay. Okay. So enter, please.
Okay.
Phone is
Hello.
ringing. Phone is ringing. Okay.
Hello. Good afternoon.
Good afternoon. Am I talking to Dr. Aisha, please, if you don't mind?
Yes, right. And
Thank you,
can
doctor.
I?
Thank you, doctor. Getting you. Doctor, my name is Priscilla Islam, and I'm 40 years of age. I'm a patient of diabetes, doctor. You have seen me a few weeks before. And doctor, if you don't mind, can I talk about something, doctor?
Yes, sure. Yeah, sure. Can
Yeah.
I confirm your age, please? You told me.
Yeah, 40
can
years, doctor. 40 years. 40 years.
Yes, sure.
Okay. Anything, doctor, you like to know now? Before I talk,
Yes.
doctor?
Right. You told me that you have seen me 4 weeks back for your as a follow-up for your diabetes, right?
Yeah, doctor. Actually, you advised me, doctor, to start injection, doctor, for my uncontrolled blood sugar, doctor. So I need to talk about
right.
something, doctor, now.
Okay, right. Sure.
So can I start, doctor?
Yes, sure.
Thank you, doctor. Thank you. Doctor, after actually getting the insulin injection, sometime, doctor, I feel dizzy, doctor. I feel and I have to sweat more, doctor. Doctor, why it is happening, doctor? I don't know. Can you guide me, doctor, if possible?
Right. So can I ask you some questions before we
Please.
can address that?
Please, doctor, please.
Right. So from how long have you been diagnosed with diabetes?
Yeah, doctor, it is around 15 years before, doctor.
Right. Okay,
Yeah,
right. And so is that well controlled after that?
Actually, not controlled well, doctor. For that, you told me to start the injection insulin, doctor, 1 month before.
Right. Have you ever checked your blood sugars at home?
Sometime I check, doctor.
Right. And what are the readings? Do you know?
Yeah, doctor, before it was too much high, maybe 15, 16. But after taking the insulin injection, doctor, it is lowered down.
Okay, right. You told me that you have been sweating and feeling dizzy after you take this insulin. So have you ever recorded your blood sugars at that time?
Sometime, doctor, but I'm sorry to say I'm not regular, doctor, to check the sugar, doctor. I'm much busy in some household work, doctor. Many guests are coming after the festival, doctor. So I can't do, doctor, well.
Okay, right. So, can you do you know about your last 3 monthly blood sugar readings? We call it HbA1c.
Yeah, doctor, it was 9.8%, doctor, when I have
Right.
seen you before.
Okay, right. So, can you tell me a bit more about the symptoms you have been complaining of? Like you told, you have been sweating, and any
Yeah,
other
doctor.
symptoms?
Yeah, doctor, I feel that I was just about to fall, doctor. I have some racing of my heart, doctor. And I become, actually, I don't know. I can't explain. If you want to know, doctor, you can ask me, doctor.
Yes. So you told me that you had some sweating and you are about to fall. So, like, did you feel any dizziness or
Yeah, and
did
I become
you?
hungry as well, doctor. I become hungry at that time.
Okay, right. And did you lose consciousness?
Not so, doctor, not so, but I am afraid of this, doctor.
Okay, right. We'll address that hopefully. Okay, right. So, have you been like taking the insulin on time, and have you also been taking your meals on time after you take insulin?
Sometime, doctor, I cannot maintain it, doctor. I told you some guests are coming and going, doctor, that I have to cook and I have to see of them, doctor. And actually, I think you told me, doctor, I'm sorry, I can't do it, doctor. I can't maintain the time that I have to take the insulin and after that I have to take the meal, doctor. Sometime I can't do.
Right. Okay. And besides insulin, are you using any other medication?
Yeah, doctor, I'm taking the metformin, doctor, tablet.
Okay, right. And so from how long have you been experiencing these symptoms? From the
Doctor,
4 weeks?
yeah, from the very beginning, doctor, little nowadays becoming more, doctor.
Okay,
Actually,
right.
I was thinking that it will be very minor problem, so I didn't talk to you. But now I am thinking that I must know about it. Why I am having such problem? Is there a problem of insulin or something else, doctor?
Right. So we'll be exploring it.
Yeah.
Okay. So any recent change in your diet or activity levels?
Not so, doctor. I am as before. My diet is as
Okay.
before, doctor.
So I'll be okay. First, I'll be asking some more questions about your blood sugar. So,
Yeah.
have you had any weakness in any part of body at any time?
Not so, doctor.
Any chest pain?
No.
Any vision problem?
Sorry, doctor. Vision. No, doctor. But
Any
when
numbness?
actually when I feel like that dizzy and other at that time, doctor, actually I have trouble in my vision at that time. Not right now, doctor.
Right. Okay. Right. And any numbness or tingling in the hands or feet?
Not so, doctor.
Any frothy? Any change in your water works?
No, doctor. My water work is now improved than before, doctor. Before I need to go to the washroom more and more. Now it is as usual, doctor.
Have you noticed any frothy water works?
Not so, doctor.
Any change in your bowel habits?
No, doctor.
Have you okay? Any weight changes?
Body weight, doctor. Yeah, I gain little weight, doctor, nowadays than before.
Okay, right. And is unintentional, right?
Sorry, doctor.
This weight gain is unintentional, right?
Unintentional. Exactly, doctor. Yeah.
So how many kilos have you gained and over how long?
Maybe 1 to 2 kilogram, doctor, in this last 1 month.
Okay, right. And okay, any raised body temperatures?
Is okay, doctor. No problem in the temperature.
Do you feel dizzy when you stand up from sitting position?
Not so, doctor.
Any tanning of the skin?
Tanning skin, doctor. No.
Okay, right. And
You have seen me. You have seen me, doctor, before. Skin, it was okay, doctor.
Right. I mean, over the past 1 month, if you develop
Yeah,
any.
doctor. Yeah.
Okay, so you told me no change in bowel habit, but particularly at any point, have you noticed any loose stools?
No, doctor.
Okay, right. And do you rotate the site of the insulin?
Actually, yeah, doctor. Sometime when I give insulin, doctor, actually, I have to push more, doctor. I think that this insulin injection is going down, doctor. So I don't know. Am I wrong, doctor, to do it? 2 minutes left. 2 minutes left.
Okay, right. Right. Okay. So what are your concerns for me?
No, the problem is that, doctor, why I am having such problem, doctor? I am afraid. So do you have anything to suggest me, doctor, to overcome the problem?
Right. So we will be adjusting your insulin doses, and I
Okay.
would advise you to monitor your blood sugars more regular intervals.
Okay.
And whenever you are taking insulin, you should also be taking the meals at the same time,
Okay.
and so that to avoid. And if any time you should also keep with yourself some sweet thing or some candies or something with you, so that anytime you feel this hunger, pain, sweating, awareness of heartbeat, you can have these things with you. And regarding your technique of the insulin injection, so I will arrange a meeting with or I'll ask some of the specialist nurse to check
Okay.
your technique and to guide you for that.
Okay, doctor. Okay.
Yeah, did I answer you?
Yeah, I got the point, but just a little more, doctor. Why I am having such problem, doctor?
So, well, it could be because of a number of reasons. It could be because of maybe the dose is excessive, the more than needed. So, for that, I'll advise you to keep checking your blood sugars more regularly, and then we'll again check your insulin
Sorry, doctor,
dose.
is it due to any blood sugar level, doctor, or something else?
Yes, from your symptoms, it seems like that it is due to the low blood sugar levels. But
Okay, doctor. Okay, understood, doctor.
so yes, so we'll. Do you have
Time
to?
up. Thank you very much. Thank you very much, Dr. Aisha.
Thank you for talking to me.
Any trouble, doctor, to talk in the
No.
this time? No. Then the colleagues what observed us, if we can recall that the approach of a telephone consultation, I have shown you some points. So I'm just actually going back a little. Then all of you from here, which is not done in the first case and the second case. All of you please look at. If I need to ask after the first case, I just skipped as you are not talking at that time. I was hurried to go to the second case. You look at the points to cover. What's not done in the case 1 and case 2. Minimum you can say in the case 2 first, then go back to the case 1 later. That means the OSCE or GP talk to the patient. What not done? Can anybody say now? I think Dr. Aisha also can say that you done too.
I have done very little of that.
Very little of that. What didn't you do? Better to say by other colleague, not by you, please. Anyone?
No.
Anyone? I hope you will learn a lot. If you can comment from here, checklist. Dr. Hind, please.
Telephone number.
Telephone number. Maybe Dr. Aisha has very good smartphone or a smart land phone that the number is visible there.
Record the date and time.
Telephone number. Now, what will be the approach? Suppose in telephonic consultation, you don't know how to say, all of you, Dr. Hind, be connected, that you are aware of knowing telephone number. In the exam hall, you cannot show it. You are assuming that, yes, I am looking at the telephone, the platform, that number is visible. But examiner doesn't know that you know the number of the patient. It may be ambiguous call also. So better to say, may I know your phone number? It will be the better option to show you a skill that you know how to talk over telephone. Thank you, Dr. Hind, to knock there. Next one. Dr. Hind, you are again muted. Please, Dr. Hind. Any other
Date
point?
and time, of course.
Date and time. So how to say in our telephone date and time? Again, okay, Mrs. Priscilla, let me note the date and time now. Just you can tell there, so that examiner understand that you are aware of that. Okay, or you are writing on the paper, okay, this is today, this date, and this 10 p.m. like that. Just to show some acting, nothing else. Okay, then Dr. Hind, you are always becoming muted, doctor. If you don't have anything more, we can invite other. If you want to say, be connected, doctor, again, Dr. Hind.
Okay.
Be connected always. Any other point from this slide? I will go to the next slide also. Anyone can comment, please. Feel free.
Doctor, please, no comments, but I want to see the slides accordingly what you have told, because I was late in connecting.
No. That one actually important thing. Previously, that was some technical point. No worry.
Okay.
It's the important point. Anything missed from the consultation. And something we assume, but we have to show by our skill to the examiner that I am aware of that. Okay. And person name, gender already you know. Priscilla. Priscilla is a male or female? Mrs. Priscilla or Mrs. Priscilla. If
Female.
Priscilla said female, did you hear the female voice today, doctor? Priscilla seems to be named as female. More likely, it is true. But some name may not be discriminating that male or female. But as you patient 1 month before, then you can say, yeah, Mrs. Priscilla, I can recall you now. Thank you very much to call me. Then it will be okay that she's female. Okay. And the next slide. Anything during advice giving to the patient. Now, please, anyone? Dr. Ahmed also, please, you are very sincere. Look at what not done. according to this slide by Dr. Aisha? Anyone?
Sorry, doctor, I was praying at that time.
Oh, okay, okay, no.
Sorry.
Other colleague, please. Sorry to call you as a praying. It would be better other colleagues can join in the interaction. Dr. Hind, didn't you observe? Dr. Amreen there? So far I can recall the name.
Safety netting, not asking.
Safety netting. Yes, safety netting not done. And actually the reason of the features hypoglycemia was not clearly mentioned earlier. Dr. Aisha tried to understand what was the problem. Maybe timing was not there, meal problem there. Another technique is the injection technique. Might be she's getting intramuscular injection could be there. And patient given a prompt that, yeah, doctor, sometimes I have to push more. Maybe there is a clue that patient getting intramuscular and it is the reason of the hypoglycemia. But the feature is the hypoglycemia and how to tackle it in future, it will cover under safety netting. You are right, Dr. Hind. Dr. Hind, can you say more also? Possibly you are attentive throughout the session.
Summary not done.
Summary not done. Dr. Aisha, do you agree summary not done?
Yes.
Yes. Maybe time problem, but I don't know. Did you have at that time in your mind? And second thing, Dr. Hind, why not telling? They request the caller to repeat the advice given.
Right.
Maybe time given more, or Dr. Aisha got the time. She could do, I don't know. Was it in your mind, Dr. Aisha, to tell the patient, okay, Mrs. Priscilla, can you tell me back what I have said to you to be done by you? Maybe
Right.
in that way you didn't do. Possibly it was not in your mind also.
Right.
The thing again I told that when the patient told that the okay, doctor, okay, I understood. Maybe again you thought that like other consultation it will be over, but even then for especially telephonic consultation, this point you can show to the examiner that you know that the patient is to repeat the information, because in between there might be some technical problem. Though interestingly, fortunately, we didn't have any problem of internet connection also. And actually we are now really what I say in a session like our examination hall. You are not looking me, I am not looking you, but we are talking together. It is more allied for your telephonic consultation situation right now. Okay. And finally, do you like to ask? Do you like to add anything more? You have done, I can remember. And let the caller disconnect first. Did you tell Dr. Aisha?
Sorry, let the caller?
Let the caller disconnect first. After thanking, okay, Miss Priscilla, if the talk is over, may I request you to close your call? Maybe you can say, I'm just creating my own words today for the first time, doctor. In general, we need to tell like that. Just we have to wait until patient close his or her call. That is the way. That is the way. That is the way. So I think you didn't do. Okay.
Yeah.
Okay. Fine. So already this over. Just for 1 or 2 minutes, may I recall Dr. Adan? Possibly I couldn't comment on that time. Dr. Adan, can you be connected now? If you can remember these two slides, Dr. Adan, and the previous one, you may understand what you didn't do. So all of you from our interaction today, that for the telephonic consultation, we must remember those things, especially this slide and this slide. I hope if you can maintain these qualities of your telephonic consultation, your performance will be over. And I can remember one of our previous colleague who passed from in the last time. Possibly you know her, that she got 100% marks. Fortunately, we had a chance to guide her also from our institute. And we had a talk to her also after the exam. Some of you might possibly attended the session. And this telephonic consultation was very new to her. So what she has done, by her general idea, general intelligence, she utilized, and possibly she got 100% mark there. What day-to-day consultation over telephone, there are some rules and there's some courtesy. If I know it, you can cover it. But as a medical
Telephone consultation.
Yeah, Dr.
Telephone
Hind?
consultation. Telephone consultation, not like case normal, yani. lot step for asking.
Actually, it will be a communication station more likely for the PACES exam, and for OSCE exam, like a full consultation. You know that in the OSCE exam, full consultation may be of communication skill mainly. So it may set later on, not recently, until we have to wait until they give, especially in the South Asian. But for the UK and others, they're already now giving this, and there is some literature also about that. So telephonic consultation like a live consultation, but keeping in the mind the limitations of breakage of what I say, the confidentiality is important, technical quality is also important to be addressed. That's all. Anything again, Dr. Tuno? So we can come to near about end. Yeah, doctor,
okay,
please.
Doctor, 1 minute, just this is the second consultation. The patient told that she has gained weight for in a very short time, too much. It was going more toward that the patient is getting more insulin.
Could be.
Not because of intramuscular, but maybe she's not knowing about how much she had to take. Second question which comes in my mind is that whether we have to confirm that the patient, what she is getting, we have to ask in detail whether she is getting 4 injection detail, 3 short acting and 1 long acting, and what is the situation, whether we have to confirm. And the third question which comes in the mind, whether we have to refer to some specialist nurse, or we have to ask her to contact her for knowing exact way of delivering this, and how much insulin she should get.
Thank you very much for your asking. First response is that in the consultation, already we understood that the features of hypoglycemia is there. It is sure.
Okay.
Now, what are the reasons of hypoglycemia? You will explore one by one. There may be 4 or 5 points are there. Finish. Second thing, advising her, guide her. Yes, there is some practice nurse. If facilities are there, nurse can go there and let her know what is the technical problem, is pushing to the muscles, and appropriate doses are there. One mismatch happened, doctor. If it is not the pre-filled injection, the mixing and others, you know, that the patient actually doesn't use the syringe and the vial of the insulin, compatible one. Somewhere 40 unit per ml, somewhere 100 unit per ml. There is a mismatch also. There are many reasons are there.
Yes.
So we need to explore it. This is the main thing here. But as a consultation in the family medicine, actually, I don't know, Dr. Ahmad, if based on PACES for the OSCE.
But PACES, yes.
Yeah,
PACES,
but in the OSCE, there is a little technical differences there. You need to go through all about the patient. Past history, details, social history, idea, concern, expectation, many things. Many things are there. For that, you need to explore more in the PACES, but you need to do in the OSCE examinee, like many headlines are there. It is called the holistic approach, not the main thing. But PACES, you must do everything. No problem. No problem. Lastly, if patient cannot understand what is wrong and others, and practice nurse also not there, the final thing will be invite the patient to come to see you with her devices and injections and others. As telephonic consultation is not a 100% perfect consultation, it could be advised for any reason. For any reason that the telephonic consultation is not satisfactory for you and the patient, invite the patient to come to see you. Okay.
Okay. Thank you.
Fine, doctor. Thank you very much. And oh, I see this one, doctor. If already consultation is over, and if you want to, if you, Dr. Omar, having something, please.
Yes. During the telephone consultation, can I advise her about this, about her diet or dietitian refer?
Everything you can do. If you're confident, yes, everything you can do, no problem. But identity, first of all, if any confusing thing that you see, sometimes sister or brother is talking, the voice of the patient is almost same. First, identification is very, very important. Today, actually, we didn't do this technical point to be addressed more. And in future, doctor, I hope so. If we can sit again in the telephonic consultation, we will give some twist in the telephonic consultation so that you can enjoy it well, because it will be developed, no doubt, as in the last year, possibly the Pondicherry, the station appeared, maybe coming 2-3 years in the PACES, it will be very top ranked topic, could be, and everybody searching these, and we got the request from many colleagues to do. For that, we are fortunate to do it today. So it will be evolved, no doubt. It will be evolved, no doubt. So I just linked our YouTube channel, doctor. If you want, you can see there. And if you want to know more about, if to be connected with us, actually very less time, I again giving you our WhatsApp number. If you want, you can communicate with us for your further materials or anything, doctor. You can see in the chat box. So be with us in future. If anything else, still you can talk to us. Otherwise, we'll go to finish now. No more. Yeah, doctor. Thank you very much for your patient hearing. And final, the take-home message will be that the history is very important, especially for the OSCE exam, no doubt. And in the communication station, if a specific task is there in the PACES, you will do that task with allied some other informations. And the last talk I told you, if you feel unhappy with the telephonic consultation, arrange a face-to-face consultation. Safety netting and follow-up clearly understood. I'm happy that Dr. Heen today mentioned it. Safety netting and follow-up must be clearly understood. And some of you asked about the 3E model, doctor. Possibly, if you go through the YouTube, you can get more details about the communication skill in our YouTube video, doctor. So until today, thank you very much to be with us. Hope to see you again in another day. Thank you very much. Goodbye.
Thank you, doctor. Thank you.